So what are you looking at right now? Is it in focus because you have 20/20 vision? You wear contact lenses, maybe prescription sunglasses, or are you squinting because you are trying to force your eyes to see clearer? We generally take for granted our vision, whatever the current state of seeing. Some folks don't even realize they can see better because it's a gradual deterioration. At least that's how it happened for me. And this is Hawaii Matters. I'm your host, Kathy with a K. Today we're going to be talking story about your eyes, your health, and how to care for them. Our guest is Dr. Dane Sultzer of Kahala Eye Clinic on Oahu. Hello. Let's get to know where you are from and where did you study, graduate, and do your residency at?
Yeah, so I grew up in Kailua, and there's no optometry school in Hawaii, and so it was a sad day when I had to leave Hawaii. I went to MCPHS in Worcester, Massachusetts. After that, I went through different clinics, all specializing in ocular disease. And then I did a residency, an ocular disease residency, over in Spokane.
What is it about eyes and vision that you're like, this is what I want to get into and get people excited about taking care of their eyes?
Yeah, it's amazing to be able to help people see better. You can also look in the back of the eye and you can see retinal vessels. When you see retinal vessels, you can diagnose a lot of conditions a lot earlier. And so it's amazing. You can, help people see, but you can also detect conditions early and intervene and come up with the best outcome for patients.
Well, you had said that you can see in the back of the eye, but
Correct.
When you meet people, like when we met and when you make eye contact with people, are you already kind of judging? Can you see, they need more vitamin C and those sorts of things? What kind of things just on the onset of you just meeting somebody in real life? Yeah. Not a doctor visit, but just in general.
Yes and no. You can sometimes clearly see cataracts. Mm-hmm. You can clearly see surfer's eye or pterygiums. You can see dryness. Sometimes you'll see people blinking. That's due to dryness.
Okay.
And so there's definitely things that you can see. Many, many people in Hawaii and all over the world have different eye conditions. It's just a part of life. And, managing those conditions, effectively, but also conveniently can really help someone's quality of life.
This is Hawaii Matters. I'm Kathy with a K with Dr. Dane Sultzer of Kahala Eye Clinic. I don't think I gave you a chance to respond as far as what got you excited about the eyes and vision.
Yeah. So, growing up in Kailua, I was able to shadow a lot of doctors. And if any of them are listening, I really appreciate the time. And, going into these different practices, seeing different medicine, you really find what speaks to you. And the eyes, they spoke to me. You can help people see better. Mm-hmm. You can look in the back of the eye. We're the only physicians that can see blood vessels. And so when you look at the blood vessels, you can see a lot of different conditions. You can see cholesterol affecting the body. You can see blood sugar affecting the body.
Wow.
You can see part of the brain in the back of the eye. Mm-hmm. And so there's a lot that we can do to help people when they come in for an eye exam.
Okay. I'm always thinking about me being a better patient with my different doctors that I see throughout the year. What does someone need to do to prepare for an eye appointment? What should they bring with them? What kind of questions might you ask? Or, it's like how to phrase things. Or like the first ever. Some people think they don't ever need to see an eye doctor. Well, I think I'm getting ahead of myself. It's just like one question begets another question.
Yeah, so I think it really depends on the individual. It depends on why they are coming to see the eye doctor. If it's a vision screening, they might not need to bring a whole lot, maybe some past prescriptions. If they're coming in for a diabetic eye exam, they're going to have to bring in more. The more information, the better. And that's one thing that I really pride myself on, is giving patients enough time during the exam to go over whatever they need. If someone has headaches, like, why? Tell me about it. And to have that time with the patient to go over their history can really be beneficial.
This is Hawaii Matters. We're talking about eye health and vision care with Dr. Dane Sultzer, Kahala Eye Clinic. When a child or an adult, everything seems fine, like their eyes are cool. Mm-hmm. When would you suggest them to come in for an eye exam?
Yeah. So the general rule is before school. So before the start of school, you definitely need an eye exam. After that, if you're an otherwise healthy individual, every year to 2 years. If there's other things going on, it depends. So for glaucoma, for example, those patients sometimes come in every 3 or 4 months. So it's just really important to find the provider that you're comfortable with that's going to have the time for you.
What are some of the necessary tests versus bells and whistles for an eye examination?
Yeah, that's a great question. So, every eye doctor should be doing certain tests. And if you've had an eye exam before, you probably know those tests, testing vision, testing peripheral vision, looking at the front and back of the eye pressure, tests like that. Mm-hmm. But there are a lot of other tests that are typically not included. And so specialty dry eye tests are one of those tests that are typically not included. Mm. And, we may look at the tear film on the front of the eye for a standard exam, but typically additional testing is not included.
It's such a trip. There's so many facets about the eyeball. What is the difference between an optometrist and an ophthalmologist?
Generally speaking, ophthalmologists do surgery.
Okay.
But optometrists also do minor procedures, not in the state of Hawaii, but they do laser surgery and other minor procedures. Both optometrists and ophthalmologists manage diseases of the eye. There are some ophthalmologists, though, that do not do surgery. And so it's a little bit more complex than maybe some people might think. For example, there are ophthalmologists that only do retina ophthalmologists. There are ophthalmologists that only do cornea. And so within ophthalmology, there are specialists. And the same thing for optometry. Optometry has pediatric optometry. Mm-hmm. They also have ocular disease, different specialties in optometry. And really, the best outcomes come from when ophthalmology and optometry work closely together.
Hawaii Matters, eye health and vision care with our guest, Dr. Dane Sultzer of Kahala Eye Clinic. My name's Kathy with a K. What is your specialty and what do you do currently at Kahala Eye Clinic?
Yeah. So I did an ocular disease residency, and so I specialize in managing conditions like glaucoma, macular degeneration, dry eye. At Kahala Eye Clinic, we also offer glasses, sunglasses, that type of thing. Mm-hmm. But we specialize in specialty contacts, so hard contacts like scleral contact lenses and dry eye.
Dry eye seems to be on the rise, or it's become more commonplace. What are some of the factors or reasons that people are developing or reporting this?
Yeah, it's a good question. Environmental factors, I think, definitely play into more dry eye. Mm-hmm. I think we are becoming better at detecting dry eye. Mm-hmm. So I think it is being identified. Maybe the food we're eating.
Diet. Okay.
Maybe the medications. There's lots of different factors that can cause dry eye. And luckily, there's effective treatments and things we can do so that way you're not affected every single day by your dry eye symptoms.
Some people might not get why that is a troublesome, bothersome thing. But when your eyes are dry, that is can be distracting. It can delay your completion of work. I feel lucky right now that if my eyes are dry from wearing contact lenses or not, it's like, okay, just blink more. Mm-hmm. And there's also over-the-counter drops. I'm very lucky that that's the extent of any kind of treatment.
Yeah.
Hawaii Matters, Eye Health and Vision Care with Dr. Dane Sultzer, Kahala Eye Clinic. Can you talk about any trends in the vision community? What has replaced LASIK? You had mentioned LASIK, but are there other ways that people can improve their vision, albeit temporarily, because nothing is permanent?
Yeah. So LASIK and PRK are really the two surgeries that we primarily use as a refractive surgery, meaning trying to get people out of glasses. So those are the two main options. But as far as taking care of your eyes, eating healthy, exercise, everything in balance, protecting your eyes from the sun. And if you do those things, your eyes will remain in good shape. But you also need to rely on your eye doctor and general physician and your medical care team.
When does someone see an eye doctor versus their primary care physician, their PCP?
Yeah. So PCPs are great for the whole body, but they don't have the equipment that an eye doctor will. And if you have a corneal abrasion, a scratch on the front of the eye, or a piece of metal in the eye, or anything like that, the general physician or PCP is really not who you should be seeing. So I would not recommend seeing a PCP for eye care.
Doctor, how do you personally maintain better health? How are you being an example in the community of eye care?
Yeah, so, I love to surf. And right now I'm experimenting with eyewear that I can wear while surfing.
Oh, okay.
So protecting my eyes from the sun. Okay. But also, when I hike, I wear protective sunglasses. I eat healthy. I try to eat dark leafy greens, things like spinach, kale. Any vegetable with a dark pigment is generally good for your eyes. And eating fish. Fish is also another really good source of high quality omega, and it's good for your eyes.
This is Hawaii Matters. My name's Kathy with a K, your host, and we're talking eye health and vision care with Kahala Eye Clinic's Dr. Dane Sultzer. I was assuming that dry eye predominantly would be because we're on so many different screens. We just don't want to miss anything.
Yeah. Well, studies show that when you have a conversation or look at a TV, your blink rate goes down. You don't blink as much. And so,
even in real life?
In real life,
wow.
Yeah. And so that definitely does cause dryness of your eyes. Contacts, especially poor fitting contacts, can also cause more dryness. And so we have, factors every single day that are going to cause irritation, inflammation, and dryness.
When you get patients coming into the Kahala Eye Clinic, are you noticing any kind of trends where, and I'm sure doctors have their, they favor certain kinds of contact lenses. You were talking about how you have hard contact lenses. I have dailies, which are soft. Why do you prefer, or maybe your patients prefer the hard contact lenses? Or actually talk about the different styles that you offer.
Yeah. So it just really depends on the patient. It depends on their eyes, their lifestyle. There's many things to consider when you're trying to fit a patient with a contact lens. So, for you, for example, a daily lens might be really easy. Maybe your prescription is very simple. A lot of patients don't have a simple prescription. They may have something else going on the front of their eye. Conditions like keratoconus, corneal thinning, severe dryness, those are conditions where a hard scleral lens might be a better option. But we're really lucky because the technology for contacts has significantly improved even in the last 5 years.
Yeah.
And so we're able to fit people with better daily contact lenses, monthly contact lenses, scleral lenses. The coating of the lens is better. The material of the lens is better. I mean, everything is better. And so you just really have to talk to the patient, figure out what their lifestyle is, look at their eyes, figure out what's going on, and then talk about the different options.
Kahala Eye Clinic's Dr. Dane Sultzer, Hawaii Matters, Eye Health and Vision Care. I'm Kathy with a K. I still remember when was driving at night in my 30s, and I was just like squinting because the street lamps look like bokeh, and I can compare it now because I'm just recently a hobby photographer, the bokeh, and I thought, wow, that looks really romantic. And I remember telling somebody about it. It's like, you should get your eyes checked. It shouldn't be like that.
Yeah.
It should be clear, round, nothing soft dots of light.
Absolutely.
Everything should be sharp.
Yep.
And I didn't realize that because it was just that kind of gradual thing. I hope somebody's hearing this and saying, oh, maybe I should get my eyes checked.
Yeah.
Even reading a menu. If you need somebody to hold the menu across the table from you, you may be a candidate for eyewear. But I don't know if these days it's not so much vanity.
Yeah.
It is just, they just don't know. People just don't understand that they need to get their eye checked.
Yeah.
Doctor,
I agree.
Doctor, what are some basic guidelines where, you may need an eye exam?
Yeah.
Let's hear some of the things that may be obvious to the doctor, not obvious to the general public.
Well, I think you're absolutely right. A lot of people wait and wait and wait. And sometimes, the changes are gradual.
Yeah.
For cataracts, for example, it's usually a very gradual change.
Can we talk about cataracts? Yeah. I mean, what are cataracts? Is that adjacent or a sign of glaucoma, or what's the difference? What does it look like from the person who may have cataracts versus the person outside who's not a doctor of eye medicine,
Yeah. So, cataracts affect the lens inside the eye.
Okay.
So it affects the lens inside the eye, and that lens gradually gets more and more blurry or cloudy.
May I compare it to headlamps, the headlamps on our car, how it becomes that kind of dull?
Yeah, absolutely.
Okay. Okay.
And so a lot of people will start to complain about glare at night. Just like you mentioned, sometimes it's not a single dot of light. It's a stretch light or it's a star. They'll also start holding things out farther, trying to turn on a lot of light so they can actually see things. And, cataracts can be very easily treated. We don't need to wait until it's an advanced cataract. And so I think a lot of people will tend to wait and wait and wait. And there's not really any need to do that. You're just essentially wasting years of good vision. You could have good vision rather than waiting and putting off the cataract surgery.
Oh, that's wild. See, I assumed that you had to wait for it to be like DEFCON, whatever, in order to get cataract surgery.
Yeah.
But it's as if your doctor suggests to get it now, because you're a good, when people talk about being a good candidate for cataract surgery, is there such a thing as an age minimum? I mean, can it happen at any age, or what's the average, I guess?
It can happen at every age. There are actually different types of cataracts. And to keep things simple, we'll just talk about age-related cataracts, which, typically happen later in life. But cataracts do start to form around 50. Even though they may not be significant, we may not need to do surgery at that time, but they gradually get more and more significant. And when it affects your lifestyle, it's affecting your vision, and you see your eye doctor, you can figure out the best plan. There are actually times where we do delay cataract surgery for certain reasons. We can do combination surgeries with cataract surgery, but we want people to see. We want to get the cataract surgery done if it is affecting their vision and their lifestyle.
Hawaii Matters, Eye Health and Vision Care. I'm your host, Kathy with a K, with Dr. Dane Sultzer, Kahala Eye Clinic. I have even more questions, and it's more about preventative care, knowing that there are doctors that are just, I love that you're excited about eye health. He's just like keeping it in check. I mean, I can tell he's like, oh, I could tell you about the latest trends. It'll blow your mind. As a surfer, you were saying that right now you're experimenting, trying out different eyewear.
Yes.
So anything sun related, people playing soccer on the golf course, on the water, sailing, hiking.
Yeah.
What kind of protective eyewear should people be wearing? I mean, is it enough just to wear a visor or a baseball cap? You know, if we have sunscreen for our skin, what can we incorporate for our eyes?
Great question. So there is a different eyewear that would be recommended for really every activity.
Okay.
And so, you know, there's a mirrored lens, for example. It's the lens that, you know, is usually a bright color and you can see yourself when you look at it. And that is better for more extreme sun exposure. So people on the water, that would be a good option. You may also want to incorporate, you know, a really high quality UV blocking coating in it, polarized lens. But you may not need that same mirrored lens if you go out to the movies or downtown with friends. You know, it does have a unique look. And so, you know, you may want to get a really dark pair of sunglasses for walking around downtown. But it's not just about the lens for certain activities. It's also about the fit. And so as we're moving, the lens or the frame can move. And that's not ideal for people playing tennis or people running or biking. And so the fit is really important also. To make things even more complicated, you really want the shape of the frame to fit you well. For example, if you have a flat frame, you're going to have sun pouring in from the sides, and that's not ideal for anyone who's going to be outside for a significant period of time. And so the frame needs to stay on your face. The lens needs to be a high quality lens. It needs to be designed in the right way. And so when you combine all those little details, you can really end up with a great product. High sun exposure can cause things like macular degeneration.
What is that?
Macular degeneration is degeneration of the back of your eye, and it can cause permanent, irreversible vision loss. And we are one of the sunniest states, and we do need to be protecting our eyes.
Even when it's overcast.
Absolutely. And surfer's eye or pterygiums. It's another example of extreme sun exposure, environmental exposure, and protecting our eyes is really important here.
Stop squinting, get better eyeglasses and protective gear. This is Hawaii Matters, Eye Health and Vision Care. I'm your host, Kathy with a K, with guest Dr. Dane Sultzer of Kahala Eye Clinic. You were talking about your specialties as a relatively new space on Oahu. What are some of the takeaways so far with the new patients that you've been seeing, and what are the top things that you want to impress upon your new patients and people, you know, who may be new to your office?
Yeah, I take a lot of time with each patient. I want to know about them. I want to know about their families, and I want to know what's going on with their eyes. If I bring someone in and do a simple exam, I may not really know what's going on with their eyes. They may not have the time to tell me. And so I want my patients to know that I will take the time, but I also want to have the best technology for eyewear, contact lenses available to the patients. So that way we can all benefit from having this amazing technology in the sunny state of Hawaii.
Hawaii Matters. I'm Kathy with a K, talking about eye health, vision care. I wear readers. That's something that I should carry around with me. I have something here. But again, it took a little while because it was like at one time in my life, now that I'm older, it's not a problem. But when I was younger, I'm like, only older people have ... Are there any things that you want to tell people in Hawaii to be on the lookout for? I mean, you said it. It's just like, it's the sunniest place. It's beautiful. One of the things that I want people to make sure they take care of their eyes is like, it is a beautiful world, even when things are going sideways. Not everybody has good vision.
Yeah.
And so what vision that you do have and you want to take care of it, you can check out Kahala Eye Clinic and, work with Dr.
I would like to encourage people to have an open mind with eyewear and contacts. I see a lot of people and they say contacts aren't for me. But there are multifocal contact lenses that can allow you to see in the distance and up close. And that can really change your life. You can go out, you can have a date with friends. You don't need to pull out your readers, and it's nice. It's convenient. There are people that I see that, enjoy hunting or fishing or whatever. And they don't like to wear their glasses when they're doing those activities. And so they go without glasses and they don't wear contacts because they say they're not a good contact lens person.
Yeah.
And that's usually not true. I see those people. We have a good time. It's entertaining at times, but eventually most of them get a contact lens in. They call me a month later and they say, hey, I went fishing and I could actually see.
Yeah.
And, I think that is important. So I would just encourage people to be open-minded to different glasses options, but also contacts.
Yeah, take care of your eyes. It's everything is connected, all your senses. If something is going kind of askew with what you're seeing, it could be heart-related. Like doctor said, it could be cholesterol. Is that something also in an eye exam with you that you will go through? You'll look at, see their future in the back of their eyes.
I won't see their future, but you're right. A lot of people will have eye-related issues. They'll have flashing lights in their vision. They'll have new floaters or spots in their vision. And they put off going to see the eye doctor. And really, if we can see the patient early, we can do a lot more for that patient. And so I would encourage people, if they do have an eye issue, if it's a red eye or a flashing light in their vision or something like that, go see an eye doctor, see an optometrist, see an ophthalmologist, just see an eye doctor. We can all help each other.
Thank you to our guest, Dr. Dane Sultzer of Kahala Eye Clinic. You can reach out to Kahala Eye Clinic at kahalaeyeclinic.com and on social at Kahala Eye Clinic. To share or replay this episode, look for Hawaii Matters where you stream podcasts. For Hawaii Matters and Pacific Media Group, I'm Kathy with a K. Mahalo.